So I had an echocardiogram done, and that came back concerning. And 2 days later, I was sitting at my desk in my office and I started having chest pains. And I was preparing to go to an important meeting and I wasn't feeling good, so I had one of my associates drive me. And my wife called me just to see how I was doing that morning. And so I told her how I was feeling. She said she was going to call the doctor. So she called the cardiologist, and they said, well, if he's feeling like that, he should go to the ER. So I went to the emergency room. They kept me for 24 hours, did another echocardiogram, and confirmed that I did have a severe mitral valve prolapse with regurgitation and leaflet flailing.
So Mr. Swink presented to his cardiologist with symptoms of heart failure, and at that time a diagnosis of a leaky mitral valve was made. At that point, Mr. Swink came to my office for surgical consultation for possible repair of his mitral valve.
At that point, I was completely ignorant of what a murmur was. Bending over and tying your shoes and being out of breath is not normal. It bothered me that I couldn't go up a flight of steps without kind of having to catch my breath. So I just figured it was a function of being older.
So mitral valve insufficiency untreated can lead to a variety of very dangerous medical problems. Patients often will complain of shortness of breath and fatigue and attribute it to old age. But quite frankly, even as we age, we should still remain active and be able to do the things that we want to do in life. So the treatment of mitral valve regurgitation surgically can be approached in a couple of different ways. The very standard, most common approach is a sternotomy, where the surgeon divides the chest bone. However, at Palm Beach Gardens Medical Center, we are able to perform the same operation without dividing the chest bone, by instead making a small incision on the right side of the chest. By doing so, we perform a minimally invasive procedure which has fewer complication risks and a much faster return to full activity and function. We also perform what's called a cryo nerve block of the right chest wall. This is where we actually freeze the nerves that are around the incision, and this dramatically improves pain control and minimizes the usage of narcotic pain medications.
By the second day, I was feeling a whole lot better, and then probably by the third or fourth day, I was already beginning to realize and recognize that I'm breathing better. I began to notice that I was actually just naturally feeling better.
So we are used to seeing patients who have very critical issues. All of our nursing staff, our OR staff, my team, we take care of patients with these ailments all the time, and that's what improves outcomes.
5 weeks to the day after my surgery, I got up at 4 o'clock in the morning and I drove to Georgia and was sitting in a hunting stand that afternoon. I'm happy to be feeling a lot better. I'm more active than I was before. My life could have ended. I could have very easily been a statistic of somebody who had a massive heart attack without ever even knowing that they had a problem.